to say, Christy, thank you for being here. She's from the NIHC, National Integrated Healthcare Group. And she's the, I guess, are you the head biller over there? I don't know if you want to give a little bio and tell them about yourself.
Yes.
Okay.
Yep. So I've actually been with, or been in the medical industry for 27 years, and I've been with NIHC Group for 22 years, I believe. And I am actually the director of operations, so I do oversee the billing team, and I actually do oversee the credentialing and contracting team as well. So wear a lot of different hats, so doing a lot of different things. And you know, I've done a little bit of everything throughout my medical career, and it's been an adventure. I enjoy it, though. Wouldn't want to do anything else.
Well, we're so glad to hear you, or have you here and hear you give this presentation about credentialing. I know this is a topic that always comes up for people. And for those of you that are watching, I also asked Christy if she could throw some in about Medicare, because that seems to be a huge thing for everybody struggling with trying to get credentialed with Medicare. So I just really appreciate you doing this and being here. And I'm just going to mute myself and turn it over to you. If you're coming into the group, just make sure you mute yourself. If you have any questions, just add it to the comments, and we'll get to the questions after the presentation.
Perfect. Yes.
Thank you.
All right. Thank you. Appreciate it. And thank you, everybody, for taking your time out of your day and joining us. And I hope you find a lot of good information out of this presentation. So I am going to go ahead and present the PowerPoint, and we will go ahead and get started. And just feel free to submit your questions as we go. But again, we'll address the questions at the end of the session. So let me share my screen here. Okay, perfect. So I've actually already introduced myself, and I am a certified provider credentialing specialist, and that goes through the NAMS. NAMS is a nationwide entity that helps govern the credentialing and contracting laws nationwide. So credentialing and contracting, they can't make up their own rules. There are rules that they have to follow. So we just want to make sure we get everyone educated about those rules and that process. So, okay, what we are going to learn today, we are hopefully going to learn the foundation elements of credentialing combined with some information related to the medical billing and as well when to apply certain elements, okay? The role of credentialing and contracting in healthcare environment is a necessary evil when it comes to insurance carriers, and everything is governed by an overseeing body for credentialing. Basically, credentialing is a way to identify the providers are who they say they are and also have obtained the education that they say that they've obtained, and it's all about patient safety. We want to make sure we know who's treating the patients out there and providing services to them and keeping those patients safe. So that's really what credentialing boils down to, is just making sure you are who you say you are. It is very detailed, as most of you might already know. When it comes to credentialing, they do ask for a lot of information. Again, it's verifying where you got your education, verifying your work history. In some cases, they do want peer references, depending on what environment you're in. And then they do require credentialing again. It's like a mini version of your initial credentialing every 3 years. And then contracting is based upon tax ID numbers. Okay, so the contracts are attached to providers, but it's also attached to tax ID numbers. So if you change tax ID numbers, you need to get those contracts changed as well. Differences in insurance types and their requirements. And we're also going to go a little bit over billing and collections overview as well. So we'll go ahead and get started, and we'll just get into a little bit more details as we go. So what is insurance credentialing and enrollments? Basically, credentialing, like I said, does have national guidelines. These insurance carriers can meet those guidelines, but they can always go above and beyond. And again, it all boils down to patient safety. So they are required to reach out to your place that you got your education and verify that you did attend during those certain time frames and that you did pass the program and you graduated and you do have that medical license. So they'll reach directly out to the board and verify that, yes, that board has issued you the license. Even though they have a copy of the license, it's called primary source verifying. So if you ever hear anybody say something about primary source, that means they have to go back to the entity that issued you that document and verify that that document is correct. I'm sure you've all heard stories about people going into a hospital claiming they're Dr. Bob, and they were not Dr. Bob, and they performed services they should not have been performing. So it's all about preventing that type of environment. And so again, it's all about patient safety. Sorry, I should have been hitting forward on my slide as we go. Again, it's to ensure that the providers are also allowed to practice in the state that they're practicing in. Especially now with telemedicine, you do have to, wherever you're at and whatever state you're in, you have to make sure that you have that appropriate license. And again, it's all about patient safety. What information is needed for insurance credentialing? It depends on the different provider types, and then it also depends on the different insurance carriers that you're working with. But again, it boils down to education and training, your licensing, if you have any type of special certificates, if you're board certified, your career history, and the qualifications that you have in order to hold that license. Some of the insurance carriers actually do background checks, and again, it's just verifying the identity of the provider and making sure that we're keeping these patients safe. Provider credentialing overview. This is basically the different reasons you might need to find yourself going through the credentialing process. If you are opening up a new practice and you have a new tax ID number, and if you haven't been credentialed before, you've always been cash, you are going to have to go through the credentialing process with these insurance carriers. If you're bringing on an associate provider, you're expanding your practice. These providers that have not been credentialed previously in your state, every state's different, they do have to go through the credentialing process in your state. If you're joining a new network, that network is going to want you to be credentialed. Network is insurance carrier as well. If you change your practice tax ID number, you don't necessarily have to go through credentialing again, but you do have to get that contract updated or a new contract reflecting your new tax ID number. Information requests from payers. Payers are always monitoring the providers and your licenses and your malpractice policies. And when those items expire, these insurance carriers either, number one, reach out to CAQH and obtain the copy of those elements out of CAQH, or number two, they send you a direct notification asking for those updated items. So our credentialing services handle many different things. We do provider credentialing. We do obtain primary source verification of certain documents, not all documents, but certain documents. We do have your information on file with the insurance carriers, and we do reach out to the different insurance carriers to make sure that they've got the information on file. They don't need additional information to get the process started or keep the process continuing moving forward. We also make sure we're evaluating the different applications that are out there. We're calling the insurance carriers every week. Sometimes it's every 2 weeks, depending where you're at in the process, asking for an update to make sure it's still moving forward, they don't need anything. And we continue to do that until the actual application or the credentialing is completed, and then you have an in-network contract with an effective date. We also offer provider maintenance as well. So we maintain your CAQH, make sure the insurance carriers have all the updated items as well. When you are performing credentialing, medical credentialing is not just protecting the patient, but it also gets the providers in network with the different insurance carriers, because some insurance carriers don't have out-of-network benefits. It all depends on the carrier. And then sometimes it depends on the policy that the patient has, because all of those policies are not the same coverage amounts. Providers can credential themselves. This is definitely something that providers can do. And I know I've talked to a couple of you out there already, and some of you already do have your credentialing complete, which is great. And then there's providers that just don't have the time, and that's what we're here for, is the providers that don't have the time, or their staff doesn't know how to do it, and we're here for that as well. So providers, your credentialing itself stays with you as long as, and it follows you wherever you go, as long as you're in the same state. Now, if you should change employment and have a different tax ID number, you still have to get attached to that tax ID number's contracts if they already have them in place. If you move to a different state, you will be required to go through credentialing again in that state, even if it's the same insurance carrier, because they need to verify that state license and things of that nature. But you don't, if you do move, say, from one city to a different city in the same state, most of the time you do not need to go through credentialing again if you were already credentialed with that plan. However, there are some networks, like if you were not in Medicare before and you want Medicare now, they might want to do a bit more credentialing for that Medicare line of business. So each insurance carrier is different. This depends on what you're trying to accomplish, but most of the time, if you're within the same state, you do not have to be credentialed again. Contracting, so there's credentialing where you're actually, they're verifying you are who you say you are, education, license, and then you move to the contracting phase where you actually have a contract with the insurance carrier under whatever tax ID number that you're participating with. And so contracting does go by tax ID number, so that as you change positions and you change where you're working, what tax ID number you're working under, your contracts will need to change. They do not follow you. If you are changing your address, you do need to make sure that your address gets updated with the insurance carrier. So if you add a second location or if you move, you do want to make sure that that gets updated with the insurance carriers. That can have an effect on your claims. Sometimes it does not, but it can have an effect if you don't have the right address listed as well. And I already talked about second location. So again, provider enrollment does get you in network with these carriers, but you have to make sure all the information is accurate and it's linked correctly. Timelines for credentialing. Credentialing can be a very long process, especially depending on the different insurance carriers. They all don't operate the same. They all don't have the same time frames. So I always tell anybody that's coming into credentialing and contracting, if you have not been credentialed before and you are going under a new tax ID number, you need to give the process anywhere from 90 to 180 days. And if there's any wrong information or data entry errors on those applications or anything of that nature, it could delay the process even further. Now, I will tell you right now with COVID, Medicare is moving a lot faster than they normally are. They were moving about 90 days. Right now, they are moving probably about 45 days. Traditional Medicare still is offering the COVID enrollment, but there's some things going on with that, which at the end here, we're going to talk about Medicare, so we'll get into that at that point. So, but on general, if you haven't been credentialed before, you've always been cash, and you're under a new EIN, tax ID number, give yourself 90 to 180 days for that process to be finalized. If a provider, like I said, just be careful. If you're going to be doing the process yourself, just make sure you're checking for accuracy. Make sure you answer all of the questions. Don't leave any information out. They are required to capture certain elements, and one of those is 10 years of work history. Now, once you get back to your education, they understand, they don't want to know what happens before that. So be aware of your licensing and practicing laws in your state. Some of the insurance carriers can go above and beyond the laws that are there for your state. So just be aware of that. And, you know, an insurance carrier, like the insurance carriers for Blue Cross Blue Shield of Texas, they process everything totally different than Anthem Blue Cross in Colorado. So just because of the same, you know, Blue Cross, they do operate a little bit differently. So just be aware of that as well. Once you are credentialed, then you can move to the contracting department, and that's where you get that contract with the insurance carrier. You have to sign it. The insurance carriers have to sign it. Once the insurance carriers sign it, it's considered executed, and then they will issue you an effective date. Most insurance carriers will not backdate that effective date. It will be the day that the contract is actually executed. Medicare is the exception to that, and we'll talk about Medicare here in a little bit. Just went over that, no backdates. Recredentialing, most insurance carriers do not require recredentialing except for every 3 years. Medicare and Medicaid are required every 3 to 5 years. It just depends on the cycle that you're in. Usually the providers receive the letters directly from the insurance carriers. Sometimes it's a letter, sometimes it's an email, sometimes it comes through your provider portals. So make sure you are logging into your provider portals for more reasons than one. But that's where you're going to get your notifications that it is time for recredentialing. Recredentialing does have some time frames to it, so you want to make sure you're paying attention to those notices coming from those insurance carriers. Don't let them sit on your desk too long. Credentialing process. So here is the credentialing process that we go through. So we originally get the information from the individual providers, and we do an audit to make sure we have everything we need that we know the insurance carriers are going to ask for. Once those documents are gathered from the provider, we verify that information ourselves. We make sure that, yes, your license is valid. We make sure that nothing's been reported to NPBD, and we'll talk about that in a minute. And so we just make sure everything's where it's supposed to be. If we do see any actions against a provider from, say, their licensing board, if there was a fine or just a reprimand or something on file, we do research that a little bit just to see what that is, and that way we can determine if we think it's going to be a problem with credentialing or not. Most of the time it's not. And then if we think it's going to be a problem with credentialing, we do notify the client and we have that discussion. Once we gather everything that is missing, we move forward and we approach the insurance carriers and we nominate the provider with the insurance carriers. Once we nominate the provider with the particular plans that they select, you get to select. We don't tell you what to sign up for because every office is different. We follow up with the insurance carriers every 2 weeks, and then when it comes closer to being finalized, we're following up weekly to make sure that they have everything they need, there's no delay. Make sure they have all the I's dotted and T's crossed. And we do that until you actually have your contract and then your actual effective date. Sometimes the contracts are provided through the portal, and sometimes they actually do come from the insurance carriers directly. And then we make sure if there's any numbers that you need, such as like Medicare PTAN numbers, we make sure you have obtained that information as well because you'll need that for the billing process. Tips for credentialing. So, if you choose to do credentialing on your own, which, like I said, you providers have done that in the past. I've actually spoken to a couple of you that have. And then, but we want to give you tips in case you do it yourself. But again, we're here for you. You know, we're here to save you that time, that frustration. We know who to talk to. We know where to send the information and what to send and things of that nature. But if you're going to be doing credentialing on your own, start early, or even if you are going to have another company help you with credentialing, start early. Don't wait until the day after you open your practice. You know, once you have that practice location locked in, whether it's a lease agreement or, you know, you've got the build out almost done and you're about 30 days out, start your credentialing. Don't wait, because as you can see before, it can take up to 6 months depending on the carrier. It's not all carriers, just a couple carriers take that long. You will have to have an actual practice location to begin the process. Now, I know with COVID, I have talked to a couple of people where they actually don't have an actual practice yet. They are they were getting ready to go into a lease or whatever the scenario was. And so everything's pretty much done via remotely right now because of COVID. So you can approach a colleague and ask them to use their address as if you were leasing the space from your colleague to get the process started, because these insurance carriers do want a practice location. Now, keep in mind, when everything goes back to normal, whatever that is going to be, you do want to get that address updated, but you do have to have a primary practice location in order to start the process. Unless you're a mobile unit, but then you still need to have an address that they want to see. Credentialing is time sensitive. The insurance carriers will give you time frames to respond to their information. Make sure you and your staff are responding in a timely manner. Medicare example, you have 30 days. From the day that they tell you something's missing, you have 30 days. And most of the time, they're sticking pretty hardcore to that 30-day time frame. The other insurance carriers will have time frames as well, but most of them are not 30 days. Make sure if you are bringing on a new staff member, make sure you give that new staff member, another provider, make sure you give that provider their credentialing packet to start completing ahead of time. You want to make sure that they're taking the responsibility of gathering all of their credentialing documents. And what I usually tell people is, if it's the first time you're going through credentialing and you have to gather all this information up, number one, CAQH is a great place to store all of your documents, your board certifications, diplomas, things of that nature that these insurance carriers are going to want, because it's all in one place. And that's what CAQH ProView is meant to be, is a place for credentialing applications and all of your documentation. So even if it doesn't say to upload that, I would strongly encourage you to upload your board certifications or diplomas that some of these insurance carriers want to see. Obviously, it does want your license and malpractice and things of that nature. And that way it's kept in all one spot. But once you do that the first time, it should be very easy to keep up with that and just maintain bits and pieces versus gathering that all together at the first time. But the first time, it does take a little bit of time. And here are some things that the credentialing packet should include: the practice address, the practice tax ID number, EIN number, your NPI numbers, the group NPI number for the group practice, if applicable. We'll talk about that in a little bit. And then your individual NPI number as well. You always want to list phone and fax numbers, because this information is going to be reported to the insurance carriers. So don't give your cell phone number. I've got some providers that gave us cell phone numbers, not realizing that that information is going into the provider directories. Now, unless you want it to be your cell phone number, but as you grow and you're more busy, I can imagine that's probably not the case. So just be mindful that you do have that phone number set up in the beginning. Phone number is very important. Fax number, it can have some wiggle room there. Your W-9, instructions for CAQH and your MPI, and then all of your insurance carriers that you will be applying for. That way, everyone in your staff, your team, knows exactly what insurance carriers you're actually applying to be in network with. And so you should have a list at all times, so you can keep on top of that. Keep track of your staff's credentialing status if you're going to be doing it yourself. It's really important to know that there have been follow-ups, minimal every 2 weeks, but as it gets closer and further along in the process, you want to do it every week just to make sure these insurance carriers aren't dropping the ball. Help mitigate delays as much as possible. Credentialing delays can result in delays in payments to your practice, which can be a detriment, obviously. Scheduling the start date of the medical staff member. Make sure that your medical staff member, if you're bringing on a new provider to your practice, make sure that maybe their start date, I've had a lot of clients do this, their start date for their associate they're bringing on is contingent based upon them finishing their credentialing paperwork ready to be submitted, because any delay of that can be costly. Try to make sure the submission dates of all of your credentialing paperwork coincides with when that provider is going to start. Sometimes you can do it ahead of time, but you don't want to go too far out in case that person does back out of the employment agreement. If you are going to seek help from third-party services for credentialing, you know, that we know that you need to focus on your practice and your patients, growing your practice and whatever tasks that you're working on. So there are third-party services out there like us that can help you with your credentialing. We can streamline it, take the stress off of you. All you do is provide us all that paperwork in the beginning, and then we take it from there. And we do provide you with monthly updates and things of that nature. That's definitely something that we can assist you with. We've done it for such a long time. We are currently in 40 different states, and we handle all different types of disciplines. So credentialing is what we do. Okay, let's get to our Medicare enrollment. I know a lot of people have some questions about Medicare. Medicare is its own animal for sure. Now, most of you, I believe, are sole proprietors, and so, which means, you know, you're the sole owner of the company, and most of you don't have associates in your company, and you probably don't have a group NPI number. Usually if you're an LLC or an Inc. or incorporation or something like that, you would have a group NPI number. But if you are considered a sole proprietor for Medicare, which that's probably the majority of you, you only have to fill out the 855I, which is, just remember, I is for the individual provider, and then the CMS 460, and then, which is your PAR agreement. That tells Medicare if you're going to be in network or out of network. And then your EFT agreement is your CMS 588. That's where you get your payments electronically. So you do have to have certain elements in order to enroll with Medicare. Those elements are, you have to have a copy of your IRS letter. They do not want your W-9. So a lot of people don't have that information. It just, if your attorney filed for your incorporation or your entity, your EIN number, or maybe your accountant, they might have that IRS letter, but it has to be a very specific IRS letter. And it's that CP 575 or 147C letter. It has to be one of the two. It can't be any other type of notice from the IRS. And I did provide you, I know you guys are going to get a copy of the PowerPoint afterwards, or it's going to be provided on the website, or I can't remember, Facebook page, but you're going to get a copy of it. But those are some phone numbers that I provided to the IRS. Both of those numbers work. If you do not have your IRS letter that is needed for Medicare, just call the IRS. Sometimes it takes a little bit to get through. So sometimes you might have your staff call, and when they get the IRS on the phone, you can jump in there. But they want to talk to the owner of the EIN number. And then you can tell them that you need one of those two letters and just give them those names. Those are the official names, and ask them to fax these letters to you because you're trying to do your Medicare enrollment. This is not a new question to the IRS. I give people this information almost daily because people just don't realize they need that notification from the IRS for Medicare enrollment. You have to have a copy of your voided check. If you don't have a voided check from on your bank account, you can do a letter from the bank. The thing you have to make sure is that the name on the voided check or the letter from your bank must match the name on the IRS letter exactly. If it does not match the name exactly, Medicare will give you a deficiency, and you'll have 30 days to get those items corrected. So it is a little bit of a game. So the trick is whatever name is on that IRS letter, and it's that first line, that's what Medicare's want to see your enrollment as, and that's what they're going to want to see your voided check or your bank letter as. If you have a group NPI, I know some of you might not because you might be a sole proprietor and it's not necessarily required. I would always advise it, but it's not necessarily required. If you have a group NPI number, make sure that name that you have for your group NPI, again, matches the name on that IRS letter 100%. So if Inc. is on your IRS letter, you want Inc. on that group NPI. Always process your Medicare applications through the PACOS portal. That's the Medicare online application. They are processing that 60 days faster than if you submitted a paper application. The PACOS username and passwords are your individual NPI, the NPPS system. It's the exact same username and password. So the NPPS, PACOS, and then that INA system, they're all linked in the background. So it's all the same username and password. It gets automatically set up once you apply for your individual NPI. So they're all the same. So you do need to process that through Paycos. And just be mindful that Medicare will send you an email if there's something that they want you to correct, or if there's something missing, and you do have 30 days to respond to that. Now, there are certain providers, mental health providers, that are not eligible to enroll with Medicare. And I should have included this on the slide. I will get that information and put it on the slide for you before it's actually passed out, so I apologize for that. I just can't remember off the top of my head right now because, of course, I put myself on the spot, but I'll get that information to you. There's some providers that are not eligible at all, mental health providers not eligible at all for Medicare. Some are eligible, but they have to have 2 years of supervision before they can apply. So again, I will get that information out to you because that does pertain to behavioral health, okay? And I think there's some other questions going in there which we can answer at the end. So billing and collections. So let's talk about billing and collections briefly. Billing and collections is a very important piece to the puzzle, okay? And let me just go ahead and get this slide all the way out here, and we can just go down these elements. Okay, so billing is getting your claims out the door. What services did you provide for these patients, and getting them out the door to the insurance carrier, okay? So a lot of times you have to make sure that you've got the correct coding going on for what services you're providing, make sure you've got the right level of service, and then you also want to make sure if there is a need for modifiers, that you've got the right modifier on there. Again, if there's a need, not everything requires a modifier, obviously. And then you want to make sure that the claims are being sent to the insurance carrier correctly. Sometimes there's 2 layers of rejections. There's a first layer of rejection is, did it even get out of your bill software to the clearinghouse? Most people are using a clearinghouse. So you've got your billing software, and then there's another company called a clearinghouse that they gather all of the claims for the providers, and then they send it to the insurance carriers electronically. So everything's done electronically these days. Most insurance carriers are not accepting paper HICSAs anymore. So you want to make sure that your claims are getting out of your billing software to the clearinghouse, and there's no issues there. Sometimes if you're not enrolled correctly, or if you've got a payer number wrong, that's when you're going to get a denial from the actual clearinghouse. And then there's another set of denials where it goes from the clearinghouse to the insurance carrier. And sometimes the insurance carrier denies it, saying, we can't match a provider, or we can't match this patient on file, or I can't remember, any other type of denial from the insurance carrier when it says something about the patient's policy, or patient not covered, or whatever it happens to be. So you want to make sure you're following those steps to make sure it's getting to the insurance carrier the first time. And then once those, the billings are out the door, then what happens is the insurance carrier processes those claims, and they send you back the EOB. That can be done, most of them are done electronically. Sometimes they're coming back via paper. You want to set up as much as you can electronically. It just speeds the whole process up with everything. Then you should be posting those EOBs, the payments back from the insurance carrier per line item, per CPT code. And then that way, if they paid one CPT code and not the other, you can follow up on that missing CPT code. Then there's another step called collections. That is just as important as getting the billing out correctly. So the insurance carriers will deny probably 25 to 30% of your claims on purpose. They know that providers are short-staffed, or they know that providers' staff just don't have the knowledge to follow up, or don't have the time to follow up. So they deny things 25 to 30% on purpose, knowing that that's probably money that they're just going to keep in their pocket, and that the providers aren't going to fight for it, or don't know how to fight for it, or are not even aware that they need to fight for it. So collections is a very piece of piece of the pie for that. Working denials from the insurance carriers. You know, you don't want to just accept what the insurance carriers say on the EOB because sometimes it's wrong. If it looks wrong, question it is what I tell my staff. And then also working outstanding AR. That's how you can make sure that you're looking at your entire AR and it shows that it was billed to the insurance carrier, but you never got an EOB back from the insurance carrier. Why? It catches those claims that are dropped into the claim black hole is what I call it. So those are very important elements. So billing is just as important as collections in the whole AR stream. Now, outsource your billing if this is something you're not comfortable with. There are lots of companies out there that can assist you with that. We also do billing, so we can also assist you if we are a good fit for you. But if you don't use us, I want to give you some tips. Never sign up with a company that charges you on the amount billed or charges you for the number of claims that are billed out of your system. There is no incentive for them to go back around, fight these insurance carriers, and get your money in the door. You always want to work with a company that is off of a percentage. That's what's collected from the insurance carriers, not the patients, but from the insurance carriers. And that gives them an incentive to fight for your claims and fight for you because they're going to get a piece of that money that comes in the door. Why would you want to outsource your billing? It can save you cost savings, actually. You don't have to worry about, number one, you yourself doing it. You're trying to stay focused on growing your practice, seeing your patients, you know, marketing, getting that word out there, building those referral sources with other providers in the area, with companies in the area, things of that nature. If you do hire somebody that's going to work in your office, you do have to have a computer for them to be using, a desk for them to be using, supplies, HR. So you've got their payroll, you've got the benefits if you're giving benefits. All of that stuff goes along with that. Processing the payroll biweekly, all of that has cost to your company. So, and reduce the headache of staffing issues, turnover. No one likes turnover. That's just something that no one likes, but it's human nature. That is part of doing business is turnover. So, but you wouldn't have to worry about turnover. Your billing company would be the one that'd be worried about the turnover if that's an issue. So, and then free up your office staff. If you do have office staff, free them up to do other things that you need to be done, or that need to be done for you. You know, focus on your patient care, things of that nature. And then whoever you work with, you should make sure that you are getting monthly reports from them. They should be giving you a report at the end of the month of how much was collected to support their invoice to you, and then a report of your AR each month so you can see and watch those buckets, the 30, 60, 90, 120, 180. Watch those buckets. Watch the insurance carriers. Ask them for feedback. Just don't turn it over to a billing company and then, okay, they're going to take care of it and never ask questions. You always want to manage them, if you will. That's what your job would be at that point, is to manage them. So here are some resources for people who might be new into the medical field, whether you're a recent graduate or whatever the scenario might be. You know, number one, get that individual MPI set up. And there's the website to get your individual MPI set up. Keep your MPI address current. If you move practice locations, update the address for your MPI. Now, if it's your home address, then you don't have to worry about that. Unless you move your home address, then you want to make sure that you've got that right address in the individual MPI. So keep an update on that and make sure your phone number and things are current there as well. Because for some reason, if a provider can't get to you, or not a provider, excuse me, an insurance carrier can't get to you based upon the information you've provided to them, they do sometimes reach out and grab the information off of the MPI. So it is important to keep that current. You always want to get your CAQH ProView account set up if you're going to be doing insurance carriers, if you're going to be taking insurance. That's basically the online credentialing application. So it is important that you get that set up and then keep that current. If you are a client of ours for credentialing. If you do not have a CAQH, we will create that for you. There is an additional fee to create the CAQH for you. But once you start into our maintenance program, we will maintain CAQH for you. We will keep it current and make sure that it's reattested for you in a timely fashion and things of that nature. And that's part of our maintenance program. You will always be primary on those notifications, but we will add our email to the CAQH account, and so we'll get that email too. And as long as you see us on there as well, you know we've got it and taken care of it. You don't have to worry about that. So PAYGOS is automatically established for you. That's the Medicare online application or portal that's automatically established for you, whether you join Medicare or not, through the NPPS website. So once you create an individual MPI, you will have an account. Now, whether or not you use it for Medicare is a totally different story, but you will have an account with Medicare at that point, okay? But again, if you don't enroll with Medicare, you're not automatically enrolled with Medicare. And the username and password for the NPPS website and PAYGOS is the same, okay? So now it is time for our Q&A questions. So I will go ahead and take a look at what we've got here so far. Okay, so the first question is, if you are in a PPO, do you have to apply separately for the HMO, Blue Cross Blue Shield? Some people are finding they're in with one and out with the other. I filed a claim, but the check hasn't showed up yet. What can I do? So here's how that works. When you get a contract with the insurance carriers, you can request specific lines of business. Now, some of the insurance carriers do have certain lines of business. And what I mean by a line of business, that would be like your HMOs, your PPOs, your open access, and things of that nature. Sometimes they do have some of those lines closed. So even though you ask for an application and you say all available lines of business, you might have been, the HMO policy might have been closed at the time that you were contracted. So if you find that's the case, well, let me back up here. If you have a copy of your executed contract, it will tell you what lines of business you're participating with for Blue Cross Blue Shield. Now, not all contracts have that, but I know Blue Cross Blue Shield does. So, so if you find that you are with the PPO, but you're not with the HMO, you can reach back out to Blue Cross Blue Shield, your provider network rep, and ask them, you know, I see that I'm not in with the HMO policy. Can I please get that added at this time? And you don't have to go through contracting again. It's a lot faster process. And at that time, they'll let you know, yes, we can get that added. You know, it's going to take so much time frame, or no, the HMO line of business is still closed at this time. So it does depend. For Blue Cross, it depends on the state, whatever state you're located in. But you can ask for those additional lines of business. When we credential staff people or providers, we ask for all lines of business, and then, but we come across that as well. Sometimes they have very specific lines that are closed, like Cigna. I think it's, there's one line with Cigna that's closed, and it is by invitation only. You can only be part of that network if Cigna invites you, and it is leaving me right now. I can't remember the name of that network, but it will come to me. So when it does, I'll let you know. So you have filed a claim, but it hasn't shown up yet. What I would suggest is if that claim is older than 30 days, I would either get onto Availity. Most of the Blue Cross Blue Shields are now working with Availity, and you can get onto your Availity portal if you're not going through another entity. Sometimes Blue Cross goes through Magellan in some states, so depends on how you access Blue Cross Blue Shield. Sorry about that. Either get on the portal, either Blue Cross or Magellan, or if you have to go, depending on the state, you might go through another carrier for mental health. Get on the portal, see if you can get claim status on the portal, and if not, have your staff pick up that phone and call your Blue Cross and find out what's going on with that claim. So usually they have to pay a clean claim within 30 days. So if it's under 30 days, you might want to give it a little bit more, but if it's 30 days or over, definitely call Blue Cross Blue Shield. Okay, so the next question we have is, have you run into any problems with a virtual address? Any tips on that? When you say virtual address, I'm assuming you're meaning like the companies that you can sign up with them and you have a address, but it's really just a PO box. So that is going to depend on the insurance carrier, yes. And we have to identify that it is a virtual address, because Medicare, you cannot use a virtual address. Medicare will do some audits, and it's just a drive-by audit. They're making sure you're located where you said you are, and that you have office hours posted and things of that nature. So yes, like a UPS store, an address. So that does not work for all carriers, definitely not for Medicare. And I would tell you Blue Cross is probably going to have a problem with that. And I'm thinking United Healthcare is going to have a problem with that as well. So far, I haven't had any problems with those other providers, but the whole virtual address is fairly new, if you will, especially with COVID and things of that nature. But I know some providers were trying to use that earlier. You can label yourself as a telemedicine or a mobile unit, even though you're not really going out to the patients, and you still need to have a corporate office, and that can be your home. But for the most part, they want to see, especially when we get back to normal, whatever that is, they are going to want to see a location where you are going to be seeing your patients. If you have a very specific insurance carrier that you have that question on virtual address, reach back out to us and let me do some research for you on that. Okay, next question I have is, how do I get the contracted rates? Some members are not getting these when they get approved, and I can't seem to get someone on the phone to get these rates. So a lot of times the contracted rates can be obtained through your provider portals. Aetna uses Availity. Some of the Blues use Availity. United Healthcare has their own portal, so you can find those on the healthcare portals is where you're going to find some of your contracted rates. Some of the contracted rates are included in your executed contract, but more often you have to get them through the portal. You can, every portal is a little different, so you just have to go on the portal and there's a place in there to request your reimbursement rates. Now, Blue Cross Blue Shield of Texas, you can actually go on their website and there is a place to request reimbursement rates. If you don't have to go through, well, Magellan recently changed. So, but yes, go for the insurance carrier portals. That's where you're going to find the majority of them. Yeah, trying to get someone on the phone to get the rates, I'm sure you're very frustrated because that's almost impossible. So next question, is it advisable to get an MPI-2 for Medicare, or is it just a preference? So if you are a sole proprietor, Medicare is not going to require a group NPI, which is MPI number 2. So if you're considered a sole proprietor, you do not have to get a group NPI. Now, what I would tell you is if you plan on expanding and bringing in an associate provider down the road, whether it's next week, a year, 2 years, you want to get it set up now with a group NPI and get it registered with Medicare as a group NPI. That just makes things a lot easier down the road if and when you choose to expand and bring on associate provider into your practice. So, but it is not required. You will not get denied for not having a group NPI. Okay, are there any other questions out there at the moment? I don't think we have any at the moment. So I think we are done for today. But Kim, let me know if any other questions come up on the Facebook. I'll try to keep an eye on the Facebook page as well. Everyone's always welcome to contact us directly. You'll see our website on the screen, our email, and our phone number as well. So it was a great webinar. Thank you so much for your time, everybody. And I hope it was educational, and I hope everyone has some good information. And I'll get those updates about provider specifics and Medicare to you.
Thank you so much. That was so helpful. Really appreciate it.
And Christy, you just want to tell them about the discount.
Oh, yeah.
Oh, yes, I'm sorry. So there is a 10% discount on our credentialing services. So if you sign up before the end of December, then we will give this group a 10% discount. So just let us know if we can assist you with your credentialing needs.
Wonderful. Thank you so much. I'm going to
Great. I appreciate it. Thank you. Okay.
Thank you.
Okay. I stopped recording. Well, thank you so much, guys. Let me take this off. Stop.